It's a Tuesday morning in your clinic. You're seeing a patient you've known for years, listening to their story, making eye contact. But something is different. You're not frantically typing notes into the EHR. Instead, a small device or app is quietly listening, transcribing, and structuring a clinical note for your review. This isn't science fiction. It's happening now in thousands of exam rooms across the country. Artificial intelligence is driving this quiet revolution. Forget the sci-fi robots. Today's AI in medicine is practical, subtle, and helpful. It's not about replacing doctors, but augmenting them, offloading the tasks that burn us out so we can focus on the human connection. AI is already woven into modern healthcare, making our work more efficient, diagnoses more accurate, and patient care safer. You've likely interacted with AI, the algorithm that flags drug interactions, the software that helps radiologists, or the system predicting high-risk patients. These are not futuristic. They're tools we use today. The question is not AI will change medicine, but will harness its power to reclaim the art of healing. This transformation is happening not us, but its success depends on our engagement. We must guide this technology, understand what it is, how it works, and how to use it responsibly. This essay is your starting point, a guide for every healthcare professional curious, skeptical, or excited about AI's role in our future. Let's explore how AI can help us build a better, more human healthcare system. What is artificial intelligence in healthcare? Let's get practical. AI refers to computer systems that perform tasks requiring human intelligence, recognizing patterns, understanding language, making predictions. It's not about creating a digital brain, but building specialized tools to solve daily problems. Machine learning models, trained on massive datasets, spot patterns, like identifying pneumonia on chest x-rays. Natural language processing powers AI scribes that turn conversations into structured notes. Computer vision lets AI analyze images, flagging cancer in biopsies or diabetic retinopathy in retinal photos. Predictive analytics sifts through EHR data to forecast events like sepsis or readmission. Think of these as new instruments in our medical bag, each designed for a specific, powerful purpose. They help us see more, understand more, and act faster. One of the most immediate ways AI is changing our daily lives is by tackling administrative overload. Documentation and endless EHR clicking are leading causes of burnout. AI-powered scribes, running on your phone or tablet, use natural language processing to transcribe and structure clinical encounters in real time. Imagine, you talk with your patient, and by the end, a comprehensive SOAP note is ready for your review. The hours spent catching up on charts can now be spent with family or on your own well-being. This isn't just about saving time, it's about restoring the doctor-patient relationship. When we're not tethered to a keyboard, we can listen more deeply and build trust. The technology fades into the background, freeing us to focus on the human work. AI scribes also help with referral letters, billing codes, and patient education materials. The goal, a seamless, intelligent clinical environment that reduces friction and cognitive load. This is AI at its best, liberating us from drudgery, not replacing our skills. AI is transforming diagnostics, especially in image-based specialties like radiology, pathology, and dermatology. Think of AI as a second set of precise, tireless eyes. While humans excel at pattern recognition, we're prone to fatigue and bias. AI analyzes thousands of images with consistent accuracy. In radiology, FDA-cleared algorithms help read mammograms and CT scans, flagging suspicious findings for review. In pathology, digital slides are scanned and analyzed in seconds, highlighting regions of interest and grading tumors. The pathologist focuses on complex cases, confirming AI's findings. This synergy combines machine precision with human expertise. AI finds patterns, the what and where, physicians provide context, the why and what's next. The result, safer, faster, and more accurate diagnostics. The doctor's wisdom and care remain irreplaceable. Every physician faces countless clinical decisions daily. AI is stepping in as a clinical co-pilot, offering data-driven insights. Integrated into the EIR, these systems act as a safety net at the point of care. For example, AI can monitor patient data in real time, flagging early signs of sepsis and sending alerts when risk rises. This early warning can mean the difference between recovery and tragedy. AI also enhances medication safety, recommending optimal drugs and dosages based on genetics and comorbidities. These tools are advisors, not mandates. The final decision always rests with the clinician. We bring judgment and understanding. AI brings computational power. Together, we make better decisions for our patients. The partnership elevates both technology and human care. Embracing AI's potential requires caution and responsibility. The challenge is not just technical, but ethical. We must ensure AI algorithms are fair and don't amplify healthcare disparities. Diverse, representative data is essential. Building trust is crucial. Patients must know their data is secure and that a human doctor is always in charge. Physicians need transparency, understanding how an algorithm arrives at its recommendations. Human oversight is non-negotiable. AI assists, but never replaces clinical judgment. We must validate AI tools, monitor their real-world performance, and have clear protocols for overriding AI suggestions. Data privacy and security are paramount. Robust safeguards and regulatory compliance are essential. Ethical guidelines, transparency, and oversight are as important as powerful algorithms. Our goal: enhance human care, not automate it away. The human touch must always lead. The future of AI in medicine cannot be left to tech developers alone. Physicians bring the lived experience of patient care. Our voices must shape AI's direction. Professional organizations are stepping up, advocating for evidence-based, transparent, and equitable AI. Physician involvement is needed at every stage: design, validation, and monitoring. We must be proactive partners, testing tools, giving feedback, and even collaborating with developers. Every clinical insight makes AI safer and more useful. Physician-led AI ensures technology serves medicine, not the other way around. Our goal: enhance care, improve outcomes, and reduce burnout. We must champion tools that augment, not replace our judgment. By leading, we protect the core values of our profession. Integrating AI into your practice is more accessible than you think. You don't need to be a computer scientist, just curious and willing to try. Start by educating yourself. Read trusted articles, attend webinars, and learn the basics. Identify a pain point in your workflow: documentation, image review, or keeping up with guidelines. Try an AI scribe or explore AI tools already in your EHR. Ask your IT department for demos or training. Volunteer for pilot programs and provide feedback. Start conversations with colleagues, share experiences, and discuss new tools. Peer learning demystifies technology and builds a community of practice. Take small practical steps to harness AI's power. The journey is collaborative. Together we can make our practice smarter, more efficient, and more rewarding. Artificial intelligence is already reshaping medicine for the better. From AI scribes to diagnostic algorithms, these tools empower us to practice smarter and more efficiently. They augment our abilities, freeing us to focus on empathy, communication, and clinical judgment. But AI's potential will only be realized if guided by those on the front lines. Physicians must lead, ensuring ethical development, rigorous validation, and real-world relevance. Let's embrace this moment with purpose and excitement. Use these tools to fight burnout, reduce errors, and restore the joy of medicine. The future is not technology versus humanity, but their thoughtful integration. Your leadership is needed. Let's build a smarter, more humane healthcare system. The revolution is here. Let's lead it.